So now let's demo our web interface for healthcare professionals. So I'm now changing my role. I'm now a doctor called Maria Poincar, and I'm going to be examining the patient that we just followed in the mobile app demo called John Ford. So at the top of the screen, I can see this patient's personal characteristics or his medical profile. Right below, I can see the prescriptions that I made to this patient. And in this case, I can see that I prescribed some paracetamol over the course of a few days because I know that he was experiencing some joint pain. And then below, what I can see is his history of medication intake. So I can see his actual drug intake, whether he took it at the right time, if he was adherent to treatment. But what I can see in pink also is his feedback. And this is what we put when we were in the mobile app demo. So we said that the patient was still experiencing some strong joint pain, and he evaluated his discomfort at a 4 out of 10. And when we zoom in, we can actually see that the patient was experiencing this pain when he was below the therapeutic efficacy threshold, which is the line in green. And when we look at his history, we can see that this patient took some Voltaren 50 milligram because I told him he could be taking this drug when the paracetamol did not suffice. And so here we can see the evolution of the concentration of the drug in this patient specifically when he took the drug, so at 5 p.m. after he was experiencing strong joint pain. So now that I know that he's really having some difficulties with his pain, I'm going to do a demo scenario where I'm going to prescribe him an opioid, so tramadol, and see what happens. So here I'm going to prescribe it for the course of 3 days. I'm going to prescribe it at 8 a.m. and I'm going to give 1. And here what we can see is the result of the simulation. So we can see the simulated evolution of the concentration of the drug in this patient. And what we can see is that during the night, the patient is below the therapeutic efficacy threshold. So now what I'm going to try is to give him the extended release form of the drug and see if it makes it any better. So here I see that it actually does make it better, but there's still this time, this zone during the night where he's still not experiencing the benefits of the drug. And so what I'm going to do is I'm going to add a dosage at maybe 8 p.m. And now we can see that the patient remains above the efficacy threshold and will remain covered by tramadol. So here all I did was make different scenarios to see what fits my patient best. And I can choose to save it, and this patient will see the prescription on his mobile app, or I can decide not to validate it. And in the case of this scenario, as it's a demo, I'm going to cancel it. But thanks to this interface, we can follow the patient's history, so his medication intake, and we can really see his specific pharmacological response and map his feedback directly to this response.